Hi, my name is Jacqueline Castillo, and the title of my presentation is Forming a Bridge Between Doctors and Patients. One of the major flaws in the U.S. healthcare system is the lack of communication between patients and their providers. For the most part, many barriers exist that interfere with the application of comprehensive patient and provider communication. Such barriers often include the lack of time spent together, language barriers, and even provider biases in medication prescription. In order to improve patient and provider communication, one possible solution is to implement health educators into the healthcare system to act as a bridge that brings together patients and their providers. Thus, this implementation will enable them to ensure that quality of care meets the needs of each patient. Currently, the lack of communication between patients and providers often affects the decisions of patients because they are unable to clearly communicate with their physicians due to time restraints and language barriers. According to Eric Rifkin, it is unrealistic for physicians to spend more time with patients in order to discuss their medical options further due to economic factors imposed in the current U.S. healthcare system. In addition to time restrictions, physicians often find it easier to simply tell their patients what to do rather than explain to them the different options they have. Rifkin explains how this is a result of the unique lenses both patients and providers hold with regards to medical practice, and the lack of tools held in order to help drive a mutually beneficial discussion between the two. This shows us that while more communication between providers and patients can be beneficial, it may not be the best option because physicians do not have enough time or the adequate tools to do so. On the other hand, health educators will have the time and resources to help their patients become more active in decision making. Language barriers can also differ among physicians and patients based on ethnicity. For example, minorities patients often face more difficulty discussing their health with their providers. A study was conducted in Norway as a result to the below average responses given to Norwegian physicians with regards to the patient communication in the 2010 Commonwealth Fund survey. This study examined the communication among physicians and patients, both Norwegian and other minorities. Findings showed that minority patients did not voice their concerns aloud as their Norwegian counterparts did. These findings clearly show us the way that language and culture act as barriers for patients, especially minorities, in terms of receiving quality care. Therefore, minority patients are often underserved and less understood. Health educators, in that case, can act as a resource towards making sure that patients feel heard or understood by their providers, regardless of their minority status. They can also answer patient questions in order to make sure that they fully benefit from the doctor's appointments as well. In order to solve these issues in communication between patients and providers, the U.S. healthcare system must implement health educators to the medical practice. According to the American Public Health Association, health education specialists are well positioned to assist in the transition to a healthcare system that rewards health outcomes over services rendered and emphasizes disease prevention and health promotion. Ways in which health educators help decrease this problem include taking the time out from each doctor visit to communicate with the patients and make sure that they understand the medical terminology used, providing patients with more knowledge on certain aspects of their health, talking to patients about their options in treatment, and helping patients adopt healthier lifestyle behaviors. Such services benefit both patients and physicians because they overrule the time constraints physicians face when seeing an individual patient, and allows them to actually interact with trained educators in order to receive services that will truly benefit them. Thus, implementing health educators will enable them to move in the direction of a more active system that provides a platform promoting patient accountability. A recent change in the healthcare has transpired with support from the Affordable Care Act in order to improve communication between patients and providers. The implementation of community health workers aims to bridging the gap between mainstream healthcare and community health by expanding the community health worker profession and its impact in clinical care. Similar to the implementation of health educators, community health workers work toward gaining the trust of the public and helping patients fight against the disparities that they face when receiving care and working towards eliminating social determinants that negatively affect their health. Although this change in the healthcare system is targeting the problem of poor patient and provider communication, it still has a long way to go in terms of gaining continuous support from various stakeholders in order to fully become effective for patients of the public. Thank you.